Now an update on the health side. More people than ever have health insurance in Colorado. A new survey finding the uninsured rate here is dropped by more than half since the new federal health care law took effect. In 2011, nearly 16% of Coloradans had no health insurance. That has now been cut to 6.7%. Our political specialist, Sean Boyd, checking out those numbers. So can we gauge exactly how much of that is due to Obamacare?
You know, what's interesting, Jim, is most of the newly insured are not getting their insurance on the individual market or the state's health exchange, Connect for Health, but through Medicaid. In fact, 450,000 more people have signed up in the last 2 years alone, bringing the total number of Medicaid recipients in Colorado to 1.2 million. We now have one of the fastest growing Medicaid populations in the country. The Colorado Health Institute, which conducted the survey, calls it a new day in Colorado. The uninsured population here now at an historic low.
We've spent so much money on Obamacare that I would hope some additional people had insurance. Unfortunately, the figures suggest that they aren't getting insurance, they're getting Medicaid.
Linda Gorman with the Republican-leaning Independence Institute says Obamacare is not doing what it promised to do. The survey found no net growth in people getting insurance on the individual market. And of those that did, only 40% bought it on the exchange set up by the state. 1 in 3 Coloradans now have some type of government insurance, many of them children. The number of children who are uninsured dropped from 7% 2 years ago to just 2.5%. More people 19 to 29 years old are also getting insurance, although they remain among the highest number of uninsured at 13%. Cost still the biggest barrier. But the number of people filing for bankruptcy because of medical bills dropped from 104,000 in 2013 to 45,000 today. Adam Fox with the Colorado Consumer Health Initiative, which supports Obamacare, says that's an indication Obamacare is protecting some of the most vulnerable.
And it shows that people with coverage, while they may be delaying care, they may be facing cost share problems, they're still protected from really high medical costs.
Now, Medicaid tells me the average cost of care for a Medicaid recipient has dropped 6% over the last couple years, but the survey found more people are having trouble accessing care. The state legislature increased some reimbursement rates for doctors to help. Medicaid says that's led to a 14% increase in the number of doctors accepting Medicaid, which is a really big deal because insurance doesn't mean much if you can't find a doctor who accepts it.
Yeah, and even Obamacare supporters say it's going to need quite a bit of tweaking as we go forward.
Right.
We'll see where it goes. Sean, thanks very much.